Hello, my name is Joe Ebner and I'm the Chief Medical Officer at Speare Memorial Hospital in Plymouth, New Hampshire. Today is Monday, April 6, 2020, and I am pleased to provide you with this COVID update to the greater Plymouth community in central New Hampshire. First, let me start by saying thank you. Thank you to all of you in the community who've been socially distancing yourself and isolating yourselves from friends and family. This has been certainly working to flatten the curve so that we can be better prepared when the COVID pandemic hits our community. It has not been easy, I am sure. For many of you, though, you may note that you seem to have more time in your day. I hope you take advantage of that time to connect with family and friends. When was the last time you may have called your mother or an old friend on the phone? This would be a good time to continue to build on those relationships. Also, this is a great time to start some new indoor or in-your-yard hobbies, or maybe get to that long book series you wanted to complete, or maybe even a movie series. There's also probably a never-ending list of home projects you might be able to complete in these times. I do not want to neglect, though, that for many of you, there is a financial hardship. At the bottom of the screen, you'll see a website, www.nheasy.nh.gov, which is the state's way to assist you in this time. Don't hesitate to reach out for financial assistance. So what do we know about COVID-19? We do know that it is in our community and across the state. About 50% of people with COVID do not have any symptoms. Most infection comes from extended, sustained, close contact with someone with symptoms or who is about to get symptoms in the next 48 hours. The majority of infections, the vast majority of infections, come from hand-to-face contact and not from the air. More on ways to protect you in a minute. You may have heard our Surgeon General announce that for many in our country, this week will be the surge. For in some of the bigger municipalities, the bigger cities across the country, they're experiencing unprecedented levels of hospital admissions because of this. This is not the case for New Hampshire, however. In New Hampshire, we expect our surge to be around April 21st, still a couple weeks away. At the current time, as of last night, there were 669 confirmed cases in New Hampshire. There have been a total of 9 deaths associated with COVID-19, which is about a 1% mortality rate. There have been 92 hospitalized patients because of COVID-19, which is a 14% hospitalization rate across our state. Bringing it a little closer to home, when we think about the Plymouth community, in the last week, we've been able to secure a relationship with a lab in Boston, which allows Speare to get about a 24-hour turnaround time. This allows us to more quickly assure patients they do not have COVID, or to help continue to isolate the patients in the hospital that do. At the current time, Speare Hospital has about 200 testing kits. We have sent out a total of 69 tests. We've received results from 67, and we've had to date 4 positive test results through Speare and 63 negative test results through Speare. At the current time, we have 1 hospitalized patient with COVID-19. What do we expect in the next couple of weeks? We do expect through this course to get close to 700 admissions to the hospital. As you can imagine, for a 25-bed hospital, that would overwhelm us if they all came within a week or two. However, thanks to your social distancing and practicing safe patterns of communication with each other, we do feel we'll be able to spread out those hospitalizations over a couple of weeks or a month. And what we're planning for is about 100 to 200 hospitalizations a week. And that is what we're preparing for. What has been our response for this proposed or this expected surge? The first thing, our practices this week are rolling out telehealth. Mid-State Health Center patients as well as Speare Memorial Hospital practices all offer the ability for you to see your provider through a secure access on the internet and through your phones, so that you can be seen by your provider without physically coming to the practices. The second thing you may have noticed is a large white tent outside of the emergency room. For those coming to the emergency room, once we start to experience a surge, the initial triage will take place out in that tent, where respiratory patients will be separated from all the others. Those that are identified as having respiratory illness will be presumed positive for COVID until a negative test result. That split in respiratory care from others will continue through the emergency room and through all of the units upstairs in the hospital. Speare has plans to increase our capacity from 25 beds in the hospital to near 40. And we are also expanding the capacity for critical care beds, including ventilator management. Our labor and delivery unit will remain COVID-free for as long as possible, so that mothers and newborns can be assured that the staff caring for them is healthy and that the other patients on the unit are also healthy. I'd like to thank our public health emergency preparedness partners, those at Mid-State Health Center, our local first responders, Plymouth State University, and the New Hampshire National Guard, who a couple of weeks ago helped Speare to put up the Plymouth Alternative Care Site, or PACS. It's currently housed in the Plymouth State Ice Arena, and this will be for those patients suffering for COVID or presumed COVID who need hospital care when our hospital becomes too full. Most of these patients will be the healthier group of patients who mostly need oxygen therapy and medications. That PACS will eventually allow for close to 100 additional patients if needed. So what can you do now to keep yourself safe? Wash your hands frequently, all the time. Every time you enter or exit a public building, wash your hands either with Purell or another kind of alcohol-based antibacterial lotion, or soap and water for 20 seconds. Do this frequently, anytime before and after eating. Do it anytime you go in and out of public spaces. The other thing to do is to stop touching your face. The vast majority of infections with COVID-19 come from touching something that's contaminated and then touching your mouth, your nose, or your eyes, all of which can lead to becoming positive with COVID-19. If we could wash hands frequently and stop touching our face, we would probably prevent roughly 99% of cases. Some of you may be asking about wearing masks. Masks are fine to wear, and probably will be encouraged more by our local Department of Health and Human Services in the weeks to come. And it's okay to use a cloth mask or one that you might make at home. It does not need to be medical grade. How this works is by decreasing the asymptomatic spread to others. The mask will keep any droplets coming from you that might be infectious, even before you're having symptoms, from getting out onto other items that could potentially transmit the virus to others. The other thing a mask will likely do is prevent you or remind you from touching your face. The other thing you can do now is to maintain that social distance of 6 feet. This virus, when it comes out in droplets, falls onto whatever's below. It doesn't remain aerosolized. And so keeping a 6-foot distance will keep any of that local droplets close to you and away from others. Do not be frightened of your neighbors. Do not be frightened to go outside. Using these precautions, staying socially distanced apart, considering a mask use, should allow you to continue to see each other from a distance safely and to continue seeing each other. Some of you might be wondering, why am I not being tested for COVID? Even though at the current time we believe we have adequate testing capabilities, we don't know how that supply will be depleted once the pandemic hits our local community. So at the current time, we continue to follow the Department of Health and Human Services of New Hampshire's recommendation to only screen or test for those healthcare workers or their families who might have COVID, those severe enough to require hospitalization, or residents and visitors to long-term healthcare facilities such as nursing homes. At the current time, the symptoms of COVID are thought to be fever, a dry or non-productive cough, and shortness of breath or heaviness in the chest. Those are the most common symptoms. There are other viral-like, flu-like symptoms, including upper respiratory symptoms, such as a runny nose, body aches, or gastrointestinal symptoms, but these are less common. If you are feeling mildly ill, the current recommendation is to stay at home and call your physician. They might be able to talk to you over the phone or set up one of those telehealth, telemedicine conference calls. If you're feeling severely ill and feel you need to be seen, call your doctor as well. They will advise you on what to do. If you feel it is emergent, most likely from shortness of breath or difficulty breathing, please come to the emergency room as soon as you feel that way. If there's a question you have about what you should do, please know at the bottom of the line is a Speare Memorial Hospital hotline, 603-238-6464. You can call that number 24/7 and speak to a nurse if you're having questions about who you should call. If you do find yourself sick and staying at home as directed, the recommendation is to self-isolate for 7 days from when the symptoms began and 3 days of recovery from the respiratory symptoms and fever. All symptomatic close contacts of that person should stay at home for 14 days from the last day of exposure. As you know, the situation changes rapidly, and for the most accurate and timely information, I would recommend you look at the websites for Mid-State Health Center or Speare Memorial Hospital. These will direct you to CDC websites as well as Department of Health and Human Services for the most accurate information. Many of you have asked, how can you help? There is a website that Speare has, there's an email address. You'll see at the bottom of the screen here. It's COVID-19 donations at spearehospital.com. You can email us with any donations you might have, and someone will get back to you to help connect where those items might be necessary. Currently, there are shortages of supplies across the country, but at our local community hospital, we are not noticing any shortages at the current time. When that changes, we'll get word out to you. Should we also identify a surge of patients in the upcoming weeks, there might be a need for medically trained personnel or people who are not trained medically but feel they could be of assistance in volunteering. This same COVID-19 donations at spearehospital.com will be an email address that you can reach out to us with what you're willing to volunteer or offer. We will also get word out as we have that need in the upcoming weeks. In closing, I know our greater Plymouth community to be one that helps each other. Don't be afraid, but be well.